Logo, BAME Vision. So just want to say thank you for joining us today for our first BAME Vision National Eye Health Week workshop. We have a series of 5 workshops planned for this week, and today being the first one. And before we get started, I just want to say thank you to everyone who's joined. Those of you just joined now, I shared before, this meeting is being recorded. So your cameras are turned off upon entering and you are muted. You will have a chance to ask questions toward the end. So you can unmute yourself and pop your camera on if you so wish, or you can pop your question in the chat function and that will be monitored and we can answer your question thereafter. So thank you for joining. And like I mentioned, this is a first of a series of workshop from BAME Vision. And we really wanted to start the first workshop as an introduction to who we are, who is BAME Vision, and how we set up and what is BAME Vision, and of course an introduction to National Eye Health Week. So I thought I'd start off by sharing a little bit about BAME Vision. Other speakers presenting today, I do have my colleague Adam Mapani, who talk a little bit about his work, his passion, and talking from the eye health perspective, and an update on actually attending eye care appointments in this current situation. Tricia Smykel from RNIB, she'll be presenting, and followed by Saliha Rashid, who'll be talking about her lived experience living with, now I can never say this, Lebers Congenital Amaurosis. I hope I've got that correct. And she'll be sharing more about living with that eye condition, living alone and working full-time, and much, much more. So back to myself in terms of BAME Vision. So BAME Vision is a group, it's a group made up of people from the eye health sector, so those working in the eye health profession, and also those from a sight loss charity, and people like Saliha and myself who actually have a sight loss. And we know some of the challenges that are faced by communities from BAME backgrounds in terms of accessing information, getting information, not just in an accessible format, but in a language that suits them, making sure that when they are diagnosed with an eye condition, actually it's in terms that they understand, and it's delivered to them, not a family or a friend that may not actually pass on the message in the correct way. But we also know that the charity sector and the eye health sector want to reach and engage BAME communities, because they have a vital amount of resources, services, so much they offer, but they know that they're not tapping into communities. And we also know people from ethnic backgrounds want to hear about these information, but because it's not presented. So it's one of those situations that we're here to kind of bridge the gap and become, trying to tailor our kind of approach in making sure that both sectors and both the BAME community actually gets to make their own choices in terms of taking care of their eyesight, but actually way before that, those at risk of sight loss get the information they need. Now, what is BAME? So BAME is an acronym for Black and Minority Ethnic Groups of People. And it's really important to say that actually lots of minority ethnic groups get lumbered into this box that's called BAME. But I think it's really important to realize and highlight that actually what challenges and the perception perhaps that the Black and African Caribbean community possibly faces may not be the same as South Asians, or perhaps Jewish people, or even Eastern European communities. So it's really about breaking down those barriers in each of those cultures to identify and tackle myths and perceptions around sight loss, to help them feel connected, not isolated, to make sure we reach out and give them their information in something that they can understand and they want to get involved with. So our mission really is to break down those barriers, to reach and engage with different communities, which we have been doing so in silo at the moment, I must admit, going out onto community radios and sharing vital messages. We have a committee who, certain members are dedicated and passionate and enjoy delivering these messages and continue to do so. And we want to increase that. We also want to improve the way people receive their information in a language they understand, but in a format they understand. And it's delivered in a way that they understand. So whether it's a letter, whether it's by email, whether it's a video, whatever it may be, making sure they actually have the information they need to prevent sight loss. There are 2 million, just slightly over perhaps as well, registered people with sight loss living in the UK, but almost half of them could be prevented because they possibly don't have the information on how to take care of their eye health or certain conditions. We know that there are certain eye conditions like glaucoma, diabetic retinopathy through having diabetes, macular, cataracts. There are a number of conditions that are really prevalent in BAME communities. So it's really important to highlight that. We also want to tackle research. We know that there's a vast amount of research out there, but actually when looking at things, not really or not much is tailored to what we need. So by using the data existing and possibly doing our own research, we can actually really dissect the information that we need to really hold the sector to account that, they need to provide services in a way that reaches out all communities. So our vision really is to improve what's out there and making it better for people who are at risk of sight loss and have lost their sight, to empower them to actually feel comfortable about talking about sight loss in their own communities. We hear often so many times that sight loss, disability is such a taboo topic, and it's often frowned upon when you think that someone has sight loss and they can't do anything with their life. Their life is over. They won't be able to amount to anything. And that's why we've got 5 different speakers at each of our workshops who'll be talking about the different eye condition they live, but actually what they've gone on to achieve. So we really want to change the perception of sight loss. So that's a little bit about BAME Vision. We do have a website which you can visit, www.bamevision.org, that has further information. But throughout the upcoming workshops, the next 4 days, we will be sharing more and more about us and what we hope to achieve and the different information. So I'm going to now hand over to Adam Mapani, who will be talking about his work, what he's seen from an eye health perspective in terms of patients. With COVID, we know there's delays to eye care appointments, but what is the current situation right now? And his personal work he has carried out in, focusing support for the African community leading up to the launch of BAME Vision. BAME Vision officially launched on the 1st of September 2021, and we've been working in silo, working kind of like working in the background, as it were, with the sight loss sector and the eye health professionals for about 12 months now. So I'm really pleased we've launched and we can showcase our work, and we want to work with you. If you've got something that you think we can support you with, if you want to get involved, please do get in touch with us. I will be sharing our contact details at the end, but for now it is info@bamevision.org. So I would like to hand over to Adam Mapani, nurse consultant at Moorfields Eye Hospital, and he is the honorary teaching fellowship at UCL and has received an MBE award. So over to you, Adam.
Thank you, Bahini, for such a nice, lovely introduction. And welcome to all our guests to the National Eye Health Awareness Week. It's such a pleasure on behalf of the BAME Vision Group to have you on board. And thank you for joining us this evening. I will try to summarize in 10 minutes what Bahini has alluded to, giving you like some important key messages that hopefully by the end of the meeting, that will be empowering, that will also provide that important update on what's going on in the clinical eye world, but more so about patient care. My passion, really, what makes me wake up every day going to work, having worked in ophthalmology for 18 years, is making an impact, making a difference. Patient care comes first. Why? Because people's sight matters a lot. So I will start by just going through some practicalities in terms of the things that we would want to discuss. So in setting the agenda, it's National Eye Health Awareness Week. And also we are going to talk about patient engagement. We're going to be focusing on updating on eye clinic appointments. So very important things. So the theme for this year, it's very interesting. It talks about your vision matters. And I can break this theme a little bit further and say your sight matters. So people's sight really matters. And the sub-themes around this year's National Eye Health Awareness Week is that it is important for all of us to regular eye health checks and regular eye tests. Very important, again, because people's sight really matters. Why we have set up, and from an eye health perspective, again, it is just important, again, to put some key messages across as to why people's sight really matters and what we have also learned from the clinical world. And some of the things that involve this, including, for example, it also including the way how we have set up things pre and post COVID. So I'm trying to make sure that we don't sort of spend so much time on the slides. I really want to make this more engaging so that we leave here a little bit more empowered tonight. So why we have set up, there is enough evidence, there is enough data to suggest that higher prevalence of certain eye conditions or sight-threatening conditions is more prevalent in Black, Asian, minority ethnic groups. So ocular conditions such as diabetic retinopathy and some other conditions also that we see in the clinical world. And these are sight-threatening. And there's also variation in attendance of eye clinic appointments. Now, I've worked in ophthalmology for 18 good years. And when I started in my kind of like early years of ophthalmology training, I had a quality time working in Tower Hamlets on an honorary basis. I used to run a retinal screening program in Tower Hamlets, Myland Hospital, 2 Fridays a month. And we know that Tower Hamlets is so nicely diversified in terms of population groups and population characteristics, the rich in diversity. It's one of the key elements that define who Tower Hamlets is. But potentially when we provide services or when healthcare or clinical services are provided, sometimes it's important to consider those cultural, social factors, language factors, but also to bring into perspective that patient or service users have got a voice. And one intervention that we did in Tower Hamlets, when we noticed that there was a little bit of variation, was to try to engage with religious leaders such as imams. And we did establish a retinal screening at one of the East London mosques, and which was quite successful on a Friday afternoon. And we managed to screen as many people as possible. And then when it comes to language barrier, it's all those small things again. Do actually patients understand the information that is being given to them? Something that we describe as health literacy. So all those things, again, they matters. And this is something that we would like to address collaboratively as a group and our key partners. And eye health awareness. So these are key messages again, the importance of regular eye tests, the importance of ensuring that we all show up for a scheduled appointment. why I say it is really important, because from a practical lived experience, as someone who is Black and African origin, I was born in Zimbabwe, I see kind of like my community as well, sort of struggling around in the area of attendance and getting to know exactly where to find the information and how credible is that information, seeking for help and so forth. Now, I'm going to a stage now we want to talk about your voice matters when we design services. So patient voice really, over the years, is part of NHS transformation, new NHS, in different government initiatives. It seems to be changing. So your voice really matters. Why it matters? Because when we design services, we always want to hear from our patients. We also want to hear from the carers involved. We also want to hear from those who use our services regularly. The way we go about doing it, we engage with patient societies such as Diabetes UK, Macular Society, and the other sight loss organizations, Royal National Institute of the Blind. But more so, I think, for example, as in the Moorfields case study, Moorfields is building a new hospital, and we want to sort of hear exactly what are the current challenges in these premises and how we can overcome those challenges. So patient voice matters, and would want to continuously engage with our patients. And then in sort of rounding up, what has changed in the eye clinic appointments? So a lot of things have changed, and you hear a lot about digital, and you hear a lot about technology. So just to break that apart, what it all means is the way we saw patients, the way we used to serve our community, our patients, is slightly different as a result of the pandemic. There is safety consideration, there's efficiency, growing backlog, some challenges in the provision of those who need urgent care. So we've established some form of digital pathways where there's high use of digital technology so that we can account for everybody. We've lost so many appointments over the course of the pandemic. In these digital pathways, there's minimum physician contact. You see a group of technicians who obtain all the necessary information like your history, do the, take the pictures, your images, they are saved and stored. And the beautiful part of this pathway, we grade most of these images in real time. So in other words, if there's any urgent indication for treatment, we are able to pick that up in the system very quickly, and we get the information across to the patient with a pre-booked appointment, patient information leaflets, and try to sort of put patient into the perspective of a face-to-face from a virtual pathway. So again, your responsibility, or what you'd want to hear in this digital pathway, is that when you get an appointment, please do show up. And if there's any queries, please, you can either call the department, you can either email us, or you can contact us in one way or the other. The same way we've been trying to provide care over the years in those face-to-face is quite similar in those virtual pathways, because all the personnel that work in there are well trained. And you hear also a lot about telephone clinics, telephone consultation. Again, these are ways of ensuring that we give you the psychological support, a lifestyle advice. We also give you an update on what's going on. So Bhavin talked about a little bit about research. So in some cases, actually, we might find that your own clinical situation or diagnosis, it might fit in one of the clinical trials. So again, this is information that we can also cascade over the phone to ensure that you come into the correct patient pathway. So there's a lot of reassurance, provision of information, and a lot of my nursing colleagues, they are running telephone consultation clinics. So at Moorfields, we do have diabetes nurse specialists. So for those with living with diabetes mellitus as a disease, and if you get an appointment to come for your regular diabetic eye check, if there's any changes with your eye or you need treatment, before we start you on a course of treatment, you receive disease counseling from a diabetes specialist nurse. In other conditions like uveitic inflammation, infection, inflammation, there is also a group of skilled nurse practitioners who are trained to support you in terms of disease counseling. Age-related macular degeneration, we are also working towards provision of information, nurses as patient educators, to improve the experience, to give you the reassurance that you need. So in conclusion, these are the things that are happening in the eye clinic world. There's also future innovation opportunities about empowering the patient at home. So you will hear also clinicians, professionals, multidisciplinary key players talking about home monitoring tools. So again, if you hear about home monitoring tools, it's not like it's inferior to what you would get in a clinical setting. By home monitoring tools, we are trying to empower the patient so that they can either self-check their vision, they can self-monitor their symptoms. They also know when to report to us calling for help. And another thing as well, an advantage of a home monitoring tool is to then reduce unnecessary visits to the eye clinic department. So unnecessary visits, they're not just costly, but they raise safety concern in the middle of the pandemic. So again, these are ways, how technology is transforming, not just clinical service design, but also patient care services. Thank you so much for your attention. I will hand back to Bhavina, our chair tonight.
Yeah, thank you, Adam. And we do have a question for you specifically, so we will come back to that in the question and answer section. I would now like to hand over to Trisha Smykel, who is a Networks and Partnerships Development Manager at the RNIB. Over to you, Trisha. And you can do a better introduction than mine.
Thank you. Thanks, Bhavini. Hopefully you can all hear me. So like Bhavini said, my name's Trisha Smykel. I'm the Partnerships Development Manager. Oh, I can see myself now, lovely. The Partnerships Development Manager at RNIB. So my role is to work with eye clinics to try and have more eye clinic liaison officers in post in London. But I suppose the reason that I'm here is because I am the business co-chair of the RNIB staff and volunteer Race Forward network. So the Race Forward network is for staff and volunteers of Black, Asian, minority, faith and minority ethnic backgrounds. So last year during the pandemic, the RNIB set up 6 staff networks, of which that's one of them. The other networks are a network for carers, there's a women's network, an LGBTQ network, a disability network separately to a network for staff with sight loss. And I think what's been really useful about this is working for a national organisation where staff are very disparate. We wouldn't necessarily know of other staff of colour within the organisation unless we were in the same team. So it's given us a real opportunity to network with each other, to find out what people's issues are around work and even personally, and to be able to support each other and also set the agenda for the organisation going forward. So at the moment it's an internal network, but we are looking at influencing some of the external work of the RNIB, because obviously we all sit within communities where we see sight loss and other conditions. And yeah, so I was saying we weren't really connected as staff unless we worked in the same offices, and now we're all working from home. So we've got that connection now for staff. And I wanted to share my personal family story, which I haven't really done before. And I was talking to Bhavini and she had shared her story, and it's the first time I'd heard that. And we'd had a discussion and it kind of prompted me to want to really share that. So I'm from a Caribbean background. My parents are from Jamaica, and there's a very strong family history of diabetes, type 2 diabetes in particular. And that had impact on my dad because he lost, he became partially sighted through diabetes and poor diabetes management. And when he was diagnosed, and it was quite ironic because having 2 parents with diabetes in 2 different hospitals, trying to navigate all of that. But when he was diagnosed, we felt as a family, we knew everything there was to know about diabetes. We knew about your feet, we knew about, following the appointments, we knew about diet, we knew about exercise, but we really didn't know about eyes and the impact that it can have on your sight. And I actually worked for Diabetes UK. So we really felt as we had all of this expert knowledge that we could pass on. But unfortunately, you know, my dad didn't always keep up with appointments and have the retinal screening on time, and had, you know, an accident, and actually had collapsed in the street and was taken to hospital. And then everything kind of went on from there, and he ended up losing his sight. So he was a very proud man. When he came to the UK, he was always proud that he'd never worked for anyone. He was a builder, so he always had worked for himself. So overnight, the ability to work for yourself, to bring income, had disappeared. And as a family, we didn't know what organisations were out there to support. So we'd never come across the RNIB. We'd never come across organisations that could help. And I think what we did have some support. So there were large print utility bills, for example. We had those, but ironically, we never had the hospital appointment letters in large print. And he went on to be diagnosed with cancer. And it was very difficult to keep on top of those appointments, because the letter would come and it would be in small print and he wouldn't realize. And then by the time we got round to it, we'd then have to chase it up. And that always became a bit of an issue for us as a family, trying to manage that. And again, not understanding the rights of accessible information and how you can request things from the NHS to support you as a person with sight loss. So I think for me, when I joined the RNIB, I started at Action for Blind People sort of 5.5 years ago now. And on my first day, I walked into the resource centre. So if any of you have been to Judd Street in King's Cross, you'd go in and the resource centre was on your right-hand side. And I walked in and there was a talking microwave, there were liquid level indicators, and I just didn't know these things existed. And my dad loved mint tea, so he'd always have a cup of tea by his side, but the amount of times that he burnt himself by overfilling the cup, and we just didn't know what existed. And again, with the talking microwave, we didn't know that these things were out there. So for us and our communities, I think it's really important that organizations reach out to communities of color. And, you know, Adam spoke about going to mosques and going to gurdwaras, and we have to, as those organizations, reach out in a way that's culturally specific and supportive, and take the time to build those relationships with those organizations, because it's so important that communities are supported and are aware of the issues and the dangers around sight loss. So we thought we knew there was everything to know about diabetes, we didn't. And if we knew a little bit more about the complications that could arise, the importance of attending the annual eye screening and all other appointments, and the importance of kind of trying to follow that healthy lifestyle, then the sight loss could have been prevented, and the impact that had on us as a family could have also been prevented. So that's really kind of what I wanted to cover. I know I've whizzed through really quickly, Bhavini, so I know I haven't taken up all of the time, but it's really just about, as mainstream charities, not just RNIB, but everyone kind of coming together to provide advice, support and guidance for organisations. I don't think it's the RNIB's place to deliver services. I think it's our place to make sure that organisations where people are familiar with know all about sight loss and where to signpost and guide people to. My dad used to go to a club called Kiwanis, and lots of different members of the community would go, and it was like a fundraising type of organisation. And if we'd have been able to go to that group and explain about sight loss, about diabetes, about other eye conditions, and how to manage and look after yourselves, that would have been more valuable than them maybe coming to us. And what then happened was my dad became very withdrawn and stopped going to those social activities because of his sight loss, and he felt he couldn't participate fully. So again, it's about enabling those organizations to deliver their services in a way where he would still feel included and would still have that social interaction. So that's me covered. I don't know if there's any questions, or if you want to do that at the end, Bhavini.
Yeah, we'll have a look at the chat box. Thank you, Trisha. That was very, very insightful. And I think it could be resonated with a lot of our attendees today. And I just want to say thank you for sharing that personal journey with us. And like you said, exactly, you know, we need to reach these communities and respect the cultural differences, because no community is the same. So thank you, Trisha.
Thank you.
We're now going to hear from Saliha Rashid, who is the chair of the UK BAME Vision Impaired Network, which is a closed Facebook group for those who are from a minority ethnic background to come and share, just come and share openly about their feelings, ask questions, and talk to people that may understand. But I'll let Saliha explain more and we'll hear more about her journey. Saliha, welcome.
Thank you, Vivini, and it's really great to be here. And thank you, Trisha, for sharing your personal story as well. I found that really moving, so thank you. As Bhavini said, my name is Saliha Rashid. I am the chair of the UKVI BAME network, which was established just over a year ago. Actually, it was the end of last August. So yes, that's very exciting. I myself am completely blind. I was born blind, and I have an eye condition called Lebers Amaurosis. I also have a younger sister who has the same eye condition as well, so it's genetic. I come from a Pakistani background. I was raised by my grandparents, which was fantastic. I look back at those very first 7 years as some of the best years of my life. And in terms of my education, I went to a special school for visually impaired people at primary, and then the school closed down in 2004, which is when I went to secondary school, which was a mainstream school. And quite significantly for me, I come from a community where visual impairment is seen as something negative. People with a visual impairment are seen as not very capable, people not being able to have kind of high aspirations or goals. And particularly for me, I found that as a woman, this was even worse, because I come from a community where women are not always treated equally to men, and also having a disability further kind of exacerbated that unequal treatment. And for me, growing up, as I got older and into my teenage years, I was always told that because I am blind and a woman, I couldn't have high aspirations and couldn't be independent. And of course, I wanted independence because I saw other blind people who were older than me who were living independent lives. And some of you will also know that I am a campaigner in the field of gender-based violence and disability. And that's because I also experienced honor-based violence in the sense of every aspect of my life was under constant control, and I wasn't allowed to do things that my sighted counterparts could do. And again, leaving this was difficult because of the visual impairment. So I then made 3 attempts to leave behind my community, and it was very difficult. And the barriers were because of my visual impairment and inaccessible information and awareness, really. So people didn't really have much awareness of issues around honor-based violence and visual impairment. But I did manage to leave when I went to university. So I completed, when I was at secondary school, I completed my GCSEs and my A-levels. And then I started a psychology degree at a university in Leeds. I'm from Bradford originally, which is in Yorkshire, so you can probably tell by my accent. So I fled from my home when I went to university, and I moved into student accommodation. I became the disabilities officer on the Students' Union. That's when I then started my campaigning work as well. I completed, I graduated in psychology, and then I went on to complete a graduate diploma in law. And then I moved down south. in 2016. It's been 5 years, also in August. So yes, and I completed a master's in social work. And I think for me, what I found and what I also found throughout my work was that I wasn't accepted by my community because of my visual impairment. And then I also found that as an Asian woman or a woman of colour, I wasn't also accepted in the white British community either. So it was this place of being in the middle kind of thing that I often found myself. And last year there was really great awareness around race and the fantastic work of the Black Lives Matter movement. And I began to think about this more. And that's when I established the UK VI BAME network, because I thought it's not just me, there will be others in my situation where you just want a safe space for people who can understand what you're going through and specific issues that are faced by people from BAME backgrounds, like what I just described, like community attitudes and things like that. And it is really successful. We have regular Zoom chats, we have discussions, we also have people who reach out for support because they might want to move out, for example. So yeah. And living alone, that's another thing you wanted me to talk about, Lavini. This is what happens when I don't plan my talks. So yeah, very quickly, I live on my own. I have been for the last 9 years. And again, I know that this is something that is discouraged often in my community. Women aren't, it's not the done thing for a woman to live alone. But again, I wanted to break free from that. And I think it's really important that we encourage, other people and who might also want to live a life of independence. So yeah, that is basically me, and I'm just on my 10-minute time, so that's a really brief introduction, but I am really pleased to be here. I'm really pleased to be sat on the BAME Vision Committee. I think it's really important and it's time that we have these kinds of discussions and raise awareness during Eye Health Week. So yes, thank you, Ravini and Adam, for inviting me.
Thank you, Saliha. Thanks so much for an inspiring talk. We're just now over to the Q&A section, and then I will share more about what National Eye Health Week, why are we doing these workshops this week, and the different workshops we've got planned for tomorrow, Thursday, Friday, and Sunday. And then I'll share information about how to get in touch with us. So there was the first question that came for Adam. I'm not sure if you shared this, but it was a question about attending physical face-to-face appointments in this current time. Are they being reopened? This person wants to remain anonymous, but they haven't been seen by their clinic for more than 3 years. Their appointments were cancelled twice, and just wants to know how long the backlog will take. Do you have any information on that, or would it be best to get in touch with their specific clinic? They do go more fields, by the way.
Sure. So what I would say, sorry to hear about the 3-year delay. What I would say is the first thing is to ring the department. Very important to get in touch with the specific department. Services are currently overwhelmed, I would say. But that's not still a very good reason for you not being seen. What I know for sure, really, just at the beginning of the pandemic, there are clearly patients who were classified in different categories in terms of risk assessment: low risk, medium risk, and high risk. And for those who required urgent care, they were seen throughout the pandemic. For example, age-related macular degeneration, other eye conditions that required urgent attention. So for the backlog, I would say, yes, there is a challenge, but we are doing as much as we can to ensure that we account for everybody. In terms of face-to-face, it's very safe. I can give you that reassurance. If you get a face-to-face appointment, it's quite safe to turn up for your appointment. There is protective personal equipment that you'll be given on arrival at the reception. Things have also changed in terms of the way how we deliver care, patient-facing. There's quite a lot of efficiency in the system, spacing, social distancing, and so forth. So it's very safe if you get a face-to-face appointment. Please do turn up if you get an appointment. And if you've got your appointment where you're still waiting for an answer, please ring that specific department and they'll be delighted to assist you.
Thank you, Adam. We had a comment for Trisha just to say that they felt resonated with your dad's story, similar story to their mum. That's from Joanna, who's logged on Facebook. So we are Facebooking this live onto the BAME Vision Facebook page. And that's a comment that's coming through our messenger. Another question for Saliha. A question's come through in terms of from a parent who wants to know, how did you manage education, well, they say university, in terms of technology, taking notes, and also starting to live alone? That sounds really scary, and just want to say well done to you, but just want some tips on education and living independently. Is Saliha muted? Saliha, can you hear me? Okay, while we wait for Saliha, anyone in the audience, in terms of participants, do you have a question? Anything about BAME Vision or what you've heard from our speakers today? Feel free to raise your hand or just unmute yourself.
Hi everyone, it's Sharifa speaking. Just a quick question. I think you guys are doing some amazing work, and I just wanted to know what you guys plan on doing or are doing in regards to like the younger generation, because I know they are more inclined to hearing other people that have lived lived experience from childhood up until adulthood, and what kind of things that you are doing to kind of engage with them.
Yeah, so just very quickly, I can start on that. We've got a few campaigns coming up. So in terms of World White Cane Safety Day up in October, and we really want to have stories from the younger generation, as well as those who may have been using a white cane for a long time, how they sort of built their confidence, you know, what barriers did they overcome to finally get to that place of confidence. So we do want to ensure that we're reaching out not just specifically to BAME communities. When we say that, you know, a wide range of the age group as well, because we know that some eye conditions occur later on in life, but are actually with research developments and advances in technology that a lot of younger, and I mean younger as in the age, well, even from birth, you know, children are being diagnosed with sight loss. So we are planning on addressing that. Does anyone else want to add anything?
Can I add, it's Trisha, just coming from that sort of diabetes background and knowing that diabetes is type 2 diabetes is prevalent at a younger age in South Asian communities and Black African Caribbean communities. I think you're right, it's really important to get the messages in early to younger people, because, you know, you can hear about type 2 diabetes prevalence from, you know, the age of 30, so from very young, and then you're living longer with that condition, so it can have more impact on your health as you get older, because it can be progressive. So we do need to reach people much younger to make them aware of risk, and also looking at family history as well, and not just diabetes but other conditions, looking at family history, and just making sure that we're aware that what that means to us children, grandchildren, if there's a family history of a particular condition, and just being very aware of that.
Great. Yeah, so beautifully summarized. I completely agree. So just to add to that as well, I think young people, it's a fair comment that they are much into technology and things. So we are also looking at leveraging on digital communication tools, how we can put message across to some of the young people through public health, eye health information. In some settings, we are also considering to go an extra mile, such as looking at where they spend much of their time, whether it's social media, platforms such as Facebook, Twitter, Instagram, and putting lots of information. So diabetes, which has been mentioned, there is excellent results coming out, especially in the UK. Diabetes is no longer the leading cause of blind registration in the UK because of retinal screening. So the key message there is to attend retinal screening, regular eye checks, and working with people like barbers, hairdressers. Again, there is opportunities to get the message across in those sort of safe communities.
Does that answer your question, Sharifa?
Yes, it did perfectly. I'm so happy to hear that, you know, you guys are reaching out to other people. And yeah, it's great work that you guys are doing. I wish that BAME Vision was around when I was growing up, because I would have felt a lot more comfortable with my eyesight. And yeah, it's
So
it's
do
it's
I.
gr- it's yeah.
So do
It's
I.
great to hear. It's great to
Thank
hear. And if you ever need someone to speak about lived experience being somewhat young, I'll be happy to help.
Yeah, please do get in touch, you know, send us an email and we can follow that up, because, you know, we are here about working together. You know, we're not the experts in everything. We can only do so much, but working collaboratively with individuals like yourself, with the eye health and the sight loss sector. And that's our motto. We're here to bridge that gap, and let's change it for the better.
Amazing. Great stuff.
Thank you. Anybody else? Does anybody else have a question or a comment rather?
I've raised my hand, Subhash here.
Subhash, yeah, go ahead.
Yeah.
The floor is yours.
Yeah, I was listening to the story. I mean, yours, of course. I've been very close to you, listening to Trisha just now and Sharifa. I mean, we have, in a very short span of time, this little group have been fairly successful also reaching out to the community since, I think we started around November or so, and we had been very successful in getting onto the ethnic radio stations. And this is where we have started making quite a large impact, or quite a good impact, because the feedback which you have started receiving, the people asking for help and trying to give them the guidelines, and as well as the consultants who have been very willing to come abroad or with us and actually answer the questions, which has been absolutely phenomenal. And I think we require all the other groups, I'm not talking about a little small social groups which you are not aware of sometimes. When they get together with us, I think we will be able to help out, reach out, and provide much more assistance to people who really require them.
Yeah,
Thanks.
Thank you. And just to let everyone know, Subhash is on our committee and actually will be presenting tomorrow. I will share in a few minutes about tomorrow's workshop, so bear with us. I'm just checking if Saliha's back.
Yeah, I'm back. Sorry about that.
Sorry, that's okay. We had a question for you. A parent was inspired by your story and just wanted to know, in terms of technology, what was used when you completed your education, and in terms of living independently, how did you start doing that?
Well, in terms of my education, so when I first started school, I'm 29 now. I turned 29 a few days ago, so a fair few years ago. Thank you. I used the Perkins Braille. And then as I went into secondary school, I was introduced to a voice note. God, that seems really old now. But yes, a voice note and then a Braille note. And then I had a Braille sense from HIMS, which is actually what I use now in terms of my work and things like that. And in terms of living alone, I think for me, because of my family circumstances and when I left home, I was kind of forced to fend for myself. So before that, I did get some daily living skills from the rehab officer at school, but because I wasn't allowed to practice or travel independently and things like that, those were all skills that I kind of just learnt as I went along, really. And then I moved down south and was thrown into London, so that was very interesting. But yeah, I think in terms of living alone, again, there are various. I don't actually have a lot of aids, to be honest. There are a lot of things that I bought that are out of the mainstream kind of market, and that I find quite easy to use myself.
Yeah, no, that's fine. Thank you. And I think on that, if you've heard certain products in there, and also Saliha mentioned a rehab officer. So a rehab officer, we are planning on doing a future workshop around the usage of a cane, what a different white cane means, and mobility aids. And in that, we will do something more around a rehab officer. But in terms of the products, please do check out the RNIB website. It does have a variety of different resources and products on offer. And that will be, I think, a good useful way to just sort of learn about the different products which are available. And I will ask Trisha to come in a bit to see if there's anything additional you want to add in terms of resources. But just on different resources. So I don't know if I actually mentioned, I didn't do a proper introduction to me. So I am the chair of BAME Vision. I also work for London Vision as their engagement manager. And as a sight loss charity based in London, supporting blind and partially sighted people who live, work or study here, one of the things that we do are managing with sight loss courses, and they are sessions open to anyone with sight loss, at risk of sight loss. If you're a family or friend member, you can also attend, and the variety of different sessions are really, on mobility aids, on different technology benefits which you're entitled to. I mean, it's so varied, but we've got resource page on our website, www.londonvision.org, sorry, and feel free to check them out. There are a variety of information out there, and we will be sharing them again throughout the week. Trisha, anything you want to say on that in terms of RNIB and services and resources?
Yeah, of course. I think that the easiest place to start is the RNIB helpline. So I'm sure that will be explained afterwards, but the number is 0303 123 9999. So you can sign up to emails about products that come out in the shop. So you'll get, I think it's a monthly email of new things that come out. So it's always quite handy, because there are things and products coming out all the time that make things a bit easier. And I've just got a direct message here, and I spoke earlier about an ECLO, an eye clinic liaison officer, somebody that works within the hospital setting. So at the point of diagnosis, you should get, hopefully, if there's one in your hospital, and they are in all Moorfields hospitals, I'm aware of all Moorfield satellite sites, but somebody just to help you get guidance, information, support, refer you to local sources of information. Again, Bhavini spoke about living with sight loss workshops. So the ECLO, the Eye Clinic Liaison Officer, will help you with what's in your area. If you need to be registered, sight impaired or severely sight impaired, again, they can talk you through that process so you can understand what the impact of that is, what's available, what's not available, and link you with your local authority sensory team. And I think, Bhavini mentioned sensory teams, and I don't know if there's a further workshop that really talks about what you're entitled to, but I think a lot of people don't know. So that was something with my family. We didn't know the things that my dad was entitled to, so we didn't claim them, so we didn't have the extra support. And maybe if he'd have seen an ECLO in the hospital when he was diagnosed, we would have got that extra information. So yeah, that's just a brief understanding.
Yeah, we are nearly at the end of our...
Sorry, Bhavini, can I just come in a second?
Sorry, of course, yeah.
Yeah, I just want to say that I'm not very good with Zoom. So if I'm getting any direct messages, I'm not ignoring you. I don't know how to access them. So obviously, if there is any specific questions or anything, just email us, and Bhavini will forward it on to me.
Sure, and just want to check, was there anybody else trying to come in there?
Yes, it's Carol.
Go ahead, Carol.
Good evening. There was someone in one of the questions I remember saying that about not getting his been last 3 months and not being able to access appointments, if I'm correct.
Yeah.
If he's dissatisfied, there is, all NHS hospitals have a department called PALS.
Yes.
And if he's not happy, we can get someone to put a letter together. As long as he's got his hospital number and he can get someone to write the letter for him, either yourselves or someone within the RNIB, and write to PALS and keep a copy, and just to state the problem he's having, how long he's had it, and what resolution he wants. So it was just, I just wanted to put that there is in the hospital's PALS.
Yeah, thank you, Carol.
Patient liaison officers.
Yeah. Thanks for sharing that information. Yes, that's another way to sort of get share your kind of feedback with the hospital itself. Can I just check if there's anybody else who'd like to come in before we wrap up for today? No. So I did mention I'll share what National Eye Health Week, so the why we're doing workshops this week. So National Eye Health Week is a campaign that's primarily run by Vision Matters, but it's a campaign that people in the eye health sector and some sight loss sectors do get involved with. And primarily it is to share the message to get your eyes tested. Like how many of us, how many people do we hear who kind of getting your eyes tested, try and avoid it if we possibly can. We've certainly heard that so many times recently on some radio engagements that we've done, because we can see fine. But we'll be sharing, particularly on Thursday's session and tomorrow, specifically around diabetes, why it's important to get your eyes checked, what can be detected from an eye test. There's so much that actually when they're checking your eyes, what's going on at the back of your eyes, so much can be picked up from it. So in particular on Thursday's session, we'll be focusing on this question, but tomorrow specifically relating to eye screening for people with diabetes. We'll be delving deep into this, but also National Eye Health Week have different themes around their campaigns. It always runs on the 3rd week in September, so it's an annual campaign. And this year's themes around dry eyes, cataracts, screen usage. I mean, how many of us are on our screens much more than we used to be? You're working from home, you're connecting online, like Zoom, for example, like meetings, but family celebrations, but also then you sit down to watch telly later on, like our screen usage has increased rapidly. So we're talking about screen usage in terms of the effect that it has on eyes. There's a session particularly focused on live well, see well, so around diet and nutrition, and again we'll be touching on that tomorrow, relating to diabetes, but generally as well. Relaxation. We often hear that we need to take some time out, we need to meditate, or we need to relax, or just be free in our thoughts. And that can be a stress relief, but actually we'll be sharing the impact it actually has on your eyes and why it's important to do so for your eye health. So on Friday's session, we have got a session on mindfulness and mental health, and specifically around how mental health can affect people with sight loss. And then we'll be having, so one of our committee members, Beverly Duguid, she's a mindfulness practitioner. So we'll be getting a demonstration, a demo of how mindfulness works. And yeah, they're the different themes that we're kind of sharing. So if you haven't got the information already about the upcoming workshops, please do email us at info@bamevision.org. and we can email that across to you. We can send you out the Zoom link. So there is a different link to each of the workshops, so we can send out that to you. And I just want to thank you all for joining us today. Today really was an introduction to who we are, and an introduction to National Eye Health Week. And then from tomorrow, we'll be really divulging deeper into the specific areas that I just briefly mentioned. So I just want to finish off by sharing our social media handles. So I mentioned that we launched on 1st of September 2021, so a few weeks ago. Our website is www.bamevision.org. We are on LinkedIn, BAME Vision, also on Twitter at BAME Vision, and we have a Facebook page also launched as well. So do connect with us. We will be sharing information through our social media, and if there's nothing else from any of the speakers, I want to.
Can I just ask, do we have to, is it the same Zoom link for tomorrow and the rest of the week?
No, so we will be sending out a separate Zoom link. So if you have signed up or if you're interested in any of the other workshops, if you let us know, we'll email you a separate link.
Okay, thank you.
Thank you. Can I check Adam, Tricia, Saliha? Any final words?
Yeah, I think for me, thank you, Bhavini, nicely chaired, and thank you everyone for attending. I think for me, key message is, please, if you have got a scheduled appointment, please do show up. If there's any concerns or worries or any thoughts, please ring the department. If there is no response, like one of my colleagues said, you could get in touch with the Patient Advised Liaison Services. Very important, again, in such time like this, that you do turn up.
Have we just lost? Yeah. Oh, I think we've just lost Adam's connection. Tricia, Saliha, can I check any final words?
Just really echoing Adam's comment about attending appointments, and if you've got concerns or queries about how to get to the hospital, there are various transport schemes. Obviously, Transport for London are giving support. So yeah, it's just really, really important to if you're called to attend, and just keeping up with eye screening. And obviously, there's more information about diabetes later on this week. Yeah, and just to thank you, Bhavini, for again brilliantly chairing, and thank you for inviting me. And yeah, really good workshop. Thank you.
You're welcome. Saliha? You might have lost Saliha, right? Well, yeah, thank you, everyone. Thank you for joining, and we look forward to sharing more information at tomorrow's workshop starting at 7 p.m. with Dr. Sheena George, Subhash Shattar, and we'll have Neeta Patel talking about her lived experience of living with diabetes and her management care and the various support out there to control your diabetes levels and preventing diabetic retinopathy. So until tomorrow, thank you for joining us today.